Therese is an amazing woman. She has her own personal story too in her wellness journey, but she's also the founder of Diabetes Alliance with extensive background in diabetes education. She has a nursing background and she held senior roles in the Australian healthcare system.
When I first heard about this particular product, I've heard about so many supplements, and I just said to somebody, "Oh no, I'm not interested." But somebody else, when you took some of them, and she had amazing results, I suddenly became very interested. And what I found was, particularly with the Revive, I have also had a health journey. I've had cancer and a number of issues with joint pain and what have you. The Revive in particular relieves my joint pain within 24 to 48 hours. It's amazing. Normally, nurses are known to be a little bit. I do not take pain management if I can avoid it at all. So when I do get into pain, what I find is I'll take turmeric, and it usually takes about a week to work. Not with this one. This is amazing. It is truly amazing. And I'm currently actually 10 hours west of Sydney in a really, really remote location with Aboriginal community. And when I realized that I may not have enough Revive with me, I did a little panic. I was like, oh my gosh, because I knew I would be in pain. And, somebody kind of gave me another bottle. It was that important to me. And I suddenly went, oh my gosh, this is so amazing. For me, it has also been life changing. Caroline will attest when I first joined a couple of months ago, I was really quite sick. Somebody had to deliver the products to me. I had chest infections and all sorts of things. And I'm much healthier, and I'm also got a lot more energy. So, like, where I'm living, there's nurses more than half my age, and they have far less energy than I've got. If 20-year-olds, again, I have much more energy than them. It's amazing how much energy I've got. But and the full feeling of wellness. But the other thing is, because I did have cancer, I get a bit worried about, maybe it'll come back. So I happened to have a horrible fall and ripped a whole lot of the cartilage off my rib cage exactly in that spot. So, there's pain in that spot on an ongoing basis. The doctors told me I would always have pain in that location. And I never anticipated taking this and taking the collagen thing would reduce my pain. It just never occurred to me. And I have absolutely noticed a significant drop in the pain around my rib cage, which is such a relief to me, because then I don't have to be going, is maybe this the cancer thing back or something. So it's amazing to have less pain, to have less pain in my joints, to have amazing feeling of wellness. And vitality that I haven't had for years. So I just do find the products good, and I am sort of telling all my colleagues, and they're a little interested. But again, we've got a lot of pushback with natural supplements because people have this preset idea that they don't work. But what I'm finding is they're amazing. It's been
Oh, wow.
absolutely amazing and life changing for me. So thank you very much, Caroline, for helping
Thank
me
you.
to learn about this.
Thank you, Therese. That is so powerful what you just shared, and it's stories like that we need to get out to the world. So, Dr. Lana, would you like to comment on what Therese has shared? She talked about Revive and also the energy that she's getting, and how she's with her nursing background, how she's skeptical about taking supplements from the start. Yeah.
Yes, that's lovely. I'm really glad that you've got this tremendous effect from the Revive. It's one of my favorite products, being a pain management specialist. And the thing is, what's key here is when you said you have the effect right away. You have an
Mm.
immediate effect, and that's pretty evident the moment, a few hours or even a day or two after you've taken them. And that's my experience too. Some of the patients will actually use this. And one thing that's also important here to understand is, as you very well know, curcumin is a huge molecule. You need to package it well, that way it will be absorbed effectively. Hence, it will also give the effect that is desired. And that's what you got, Therese. And with the review too, I was able to start be able to taper my patients off of their narcotics. You very well know that in this country, 95% of narcotics are used in here in the United States. 95% of the world's opioid manufactured, for the global use is 95% is actually used in this country, unfortunately. So I have this moral responsibility to share this product to my patients. And yeah, there's room for opioids, which is post-operatively, acute post-operative pain or acute pain. But when you are dealing with chronic pain, I think there is room for nutraceuticals like Revive. So it helped me. It really started to help me be able to get my patients off of their narcotics.
Wow. Wow. Thank you, Dr. Lana.